Welcome everyone. We're just going to give everybody a few minutes to get signed on and then we'll get started. I think we logged in like about 1 minute sooner. I know this is a fantastic topic and it's on a lot of people's minds. So I know that we're going to do a good job and maybe answer a lot of your questions. So I'm just going to give it a second so that people have time to get on. So it's right on time. So I want to make sure we start on time because we have a lot to cover. So good afternoon, everyone, and welcome to the BENCO webinar. My name is Kay Huff, and I will be the BENCO host for today. I definitely want to take a moment to thank everyone for coming on the webinar. We've actually enjoyed doing them, so we really appreciate your time. We really enjoyed putting the webinars on for you. So I want to go over the CE guidelines because you will receive a 1-hour CE. It's really simple. Number one is that you have to register in your legal name. And by your legal name, I mean whatever is on your license that you'll be turning in to receive credit. Each person must register separately. You can't watch it together and both get CEs. You have to register separately. You also must log in on your own device. The reason that you do that is so that we can cross-reference that you are also there. Also, please be aware that it takes, in order to receive the CE, you must be on for the complete hour. At the end of the course, we will offer a survey. Please make sure you complete that survey and let us know, what we could do better or maybe some of the topics that you would like us to cover. It takes about 30 days to receive your CE, so just be patient, but I promise you, we will get it to you. The thing is that if you're listening on your cell phone, if you push the link to go onto Zoom, you're fine. However, if you've dialed in, we can only see your telephone number. So what we'll need you to do is to please email me your name, the title of the course, and the telephone number that you're watching the webinar on, and we will cross-reference those, and you will still receive your CE. Don't panic. I'm going to give it to you at the end, but the email is practicecoaching@benco.com. Again, that's practicecoaching@benco.com. I also want to point out that Tim really wants to answer all of your questions. So below, you're going to see a Q&A. Please make sure that you put any questions that you have. I think we already have one in there, Tim. Please make sure that you put any questions that you have, and we will try to answer those live. However, if we don't get to them live, it's all right. Tim and his team are going to answer them for us offline, and everybody that's logged on today will get a copy of all the Q&A. So that's fantastic. So with all that being said, I'd like to introduce the most amazing leader you could ever want to work for. He's enjoyed giving these webinars to our customers, and he is looking forward to seeing what we can do more to make sure that you're taken care of. With that being said, I'm honored to introduce my boss and our amazing leader, Chuck Cohen.
Hey, thank you very much. The introductions just get better and better all the time. Good to see everybody. Glad you're here. Thank you.
Chuck.
Oh, well, thank you. So today we're really privileged to hear from Tim Twigg. I think it's our 4th webinar with Tim, if I'm keeping count of him right. As we've all come through the COVID-19 challenges, the shutdown, the reopening, certainly managing the people who work with us has been one of our biggest challenges. Tim is the noted expert on managing HR from the dental perspective. He probably wouldn't want me to say this, but I'll say it anyway. He's actually speaking to us. He told us before he's been moved out of his house. He actually is in Oregon, and so he and his family had to evacuate. But and hopefully there's no harm to their house and they'll be fine. He may talk about that later or not, but the main thing I want to say is because he's dedicated to bringing this information to everyone. I mean, he's, if there ever was a reason to cancel today's program, that could have been it. But Tim really is passionate about the topic. And I would say that we are very fortunate to hear from him today. So Tim, CEO of Bent Erickson and one of the nationally known leaders on dental human resources issues. Thank you for being with us today, and thank you for sharing.
All right. Thanks so much, Chuck. Thanks so much, Kay. Let me do a little flip screen here, and we'll dive in. Okay, so our topic is we're approaching the fall, and it's already September, and so now it's facing the challenges as they relate to HR and some of the considerations that are coming into play. I also have on webinar with me is Michelle Allen, and she is one of our senior HR specialists. So as we get into this and we're dealing with Q&A in particular at the end, I'll be no doubt calling on Michelle to have her be part of the process of disseminating the information and making sure that you're getting the kind of answers to the questions that you're looking for. So relative to our agenda for this webinar, here's what we're going to be talking about. We'll do a fairly short review and update of the FFCRA, as well as a review and an update of the FFCRA exemption criteria. We're going to look at some of the employment challenges that we know practices are facing, some ideas and solutions around that. We're going to talk a little bit about hiring, because we recognize that there are some significant challenges going on out there as it relates to the recruiting and the hiring process. And then we're going to talk a little bit about shifting really from crisis management, which is what most all practices were in starting in April, and shifting from crisis management to truly a leadership and a rebuilding piece for your practice, with this emphasis on the human side or the HR side of the practice. So relative to an FFCRA update, any of you who may have been sleeping for the last 6 months, FFCRA stands for Families First Coronavirus Relief Act, and this was the first piece of legislation that was passed by the federal government in response to the pandemic. The provisions and this legislation is currently set to expire on December 31st. Some of you might look at that as, well, the good news is it's going to expire on December 31st. The bad news is we're still in it, and that means it does not expire until December 31st. So it's important that you're aware of this and you are mindful about what it really represents, what it means to you as an employer, and how it relates and affects your employees. Relative to the FFCRA, one of the things that is really a clear, I think, delineation with this bill, it is, for all intents and purposes, a wage replacement bill. That's what the overriding objective for Congress was. If employees cannot work, and that inability to work is directly related to COVID and the COVID pandemic, then this bill provides replacement wages for the employee. Those replacement wages are built around an emergency paid family leave portion or aspect of the bill, and an expanded family and medical leave aspect of it. So a lot of attention is to the leave and sick leave and family leave. Just understand that that packaging of the bill was really about how do we create an opportunity for some wage replacement, and it just is coming in the form of some paid sick leave and paid family leave. There are 6 qualifying reasons that would have an employee be eligible for either the sick leave or the family leave. Those 6 qualifying reasons are very specific to COVID. Here are the 6 reasons. The first 3 deal with the employee, his or herself. The next 3 are more about caregiving or providing care for sons and daughters, family members, etc. So that's why there's a little separation between the first 3 and the second 3. It's important to note that eligibility is limited to just these 6. This is not if someone has a common cold. This is not if someone just has the flu or has some other health-related thing. Unless it is directly related to COVID-19, then FFCRA does not come into play. Relative to FFCRA coming into play, Any one of these qualifying reasons would allow someone to be eligible for the sick leave aspect and the wage replacement associated with it. It is only reason number 5 that represents a qualifying reason whereby someone would be eligible for the family leave. So family leave only applies to qualifying reason number 5. Now, relative to the amount of time that someone is that is available to an employee, from a sick leave standpoint, if there's qualifying reasons that make someone be eligible, then they could be eligible for up to 80 hours of paid sick leave. The up to is prorated based on how many hours a person typically works. So if there's an employee who typically works only 32 hours in a week, let's say, then this person would be eligible for 32 plus 32, or 64 hours. So they're eligible for up to 64 hours of paid sick leave, not the 80. So the 80 is kind of a cap on it. It doesn't go over that, and it's based on the typical hours or normal hours that a person works in a week. Similarly, with the paid family leave, it is for up to 12 weeks, although the first 2 weeks are unpaid. And what constitutes a week? Again, it's the normal hours that a person works. Again, back to my example, if it's an employee who works 32 hours in a week, then they would be eligible for paid family leave for 32 hours a week for the 12 weeks, although again, the first 2, you are not getting any wage replacement. The theory there is that the sick leave piece is activated first. It runs out, say, at the end of 2 weeks, and that's where the paid family leave would pick up and move forward from there. In terms of wage replacement, if someone truly qualifies and is eligible for the sick leave portion and the qualifying reason is either 1, 2, or 3, then the wage replacement is the person's normal wages up to a maximum of $511 per day. If the qualifying reason is for 5 or 6, then the person's wage replacement is 2/3 of their normal wage up to a maximum amount of $200. So it can be a little tricky sort of figuring this all out, but there are people like us and our team as well as others around who can help you navigate through qualification, eligibility, and exactly what applies. A really important aspect of this is to note that the benefits that you are paying out for the paid sick leave or the paid family leave are being funded by the federal government. Yes, they run through your payroll and should be itemized as a separate item on a pay stub, but then you simply deduct that from the normal payroll tax deposit that you make. And most of you make a payroll tax deposit either twice a month or once a month. So you're, in a sense, getting reimbursed, but you don't sit around and wait for a reimbursement. It just gets deducted from your normal payroll tax deposit. So it's important to know that this is not costing you any money. The federal government literally is funding this wage replacement. So it's not so much a financial issue, it's more of just sort of a hassle issue of just having to understand it and administer it. when we talk about the FFCRA, then of course exemption comes up, and even though I just said it's not so much a financial issue, it's more of a hassle issue, there are some provisions that do allow practices to be exempt. And so naturally, when people first heard about this, everyone wanted to be exempt, and on some level, I can certainly appreciate and understand that. Built into the FFCRA are really two sort of avenues that potentially deal with exemption for dental practices. One of those is for any dental practice that has less than 500 employees. And the exemption there is based on whether dental practices meet the definition of being a health care provider. Now, in our HR world, for almost all federal legislation, wherever they define and talk about healthcare providers, dental practices are not included. But for the FFCRA, the federal government used a broader definition of a healthcare provider, and that broader definition did include dental practices. So that would mean that in all likelihood, dental practices could be deemed exempt from FFCRA if you have less than 500 employees. I'm going to get into a few more nuances of that in just a minute. The other provision that deals with exemption applies specifically to practices who have less than 50 employees. And there the exemption says this exemption can be applied if, by adhering to or complying with the FFCRA, it would put an undue burden, financial burden, on the practice and even question your survivability. Number two, if this person who you would otherwise be providing the wage replacement and the leave to is so critical and so important to your practice that you can't practice without them, or number three, that there is no one else out there who you can hire to replace this person. And I think most of you who have been tracking with this, you get that these three can be a little bit challenging to sort of contend. I mean, on the financial side, the federal government is reimbursing you for this, so it's not costing you anything at all. So it's going to be difficult for you to say this puts an undue financial burden on my practice. To the piece about this person is so critical I cannot practice without them, well, this person more than likely has taken some vacations during the time that they work for you. Maybe they've also gotten sick somewhere along the line and taken some days off, and you figured out a way to work around that. So again, it might be kind of challenging for you to contend this person is so critical I can't practice without them. And of course then, that there's no one else out there who can do this, while I get that the job market right now is pretty tight in terms of available people, it can also be kind of challenging to, I think, truly hang your hat on that exemption. But it's just important to know these two different potential exemptions exist if indeed this is a path that you do want to pursue. Speaking about pursuing it, just understand that if you claim exemption to FFCRA, it needs to be applied equally and fairly for all employees. If you're going to go down this path, we encourage you to take a snapshot of this screen. You should call that toll-free number that is there on the screen, follow these prompts, enter your zip code, and who you're calling is the Wage and Hour Division of the Department of Labor. And you tell this person how many people you have employed in your practice, and then you've got to ask two questions. One question is your business and admin employees exempt from FFCRA? And ask whether your clinical care employees are exempt. The reason this becomes important is, I said earlier that the government had a looser definition for a healthcare provider. We have talked to a lot of wage and hour divisions of the Department of Labor, and all of them concurred with that expanded definition and therefore dental practices being exempt. But about a month ago, a federal court in New York ruled that was invalid. The Department of Labor has now sort of gone back to the drawing board, and last Friday night issued updated exemption criteria that retightened up the definition of healthcare provider, and we believe in that tightening up, they all but eliminated the exemption you could claim as sort of an overall blanket exemption as a dental practice and healthcare provider. As a result, we're taking a little more of a conservative approach to this, thinking the only exemption provision that may now still exist for dental practices is the one about clinical staff versus admin staff and healthcare providers, etc. So you need to call your wage and hour division. Again, there's the number, there are the prompts. Ask those two questions and ideally get some documentation about this if indeed the person you talk to says, indeed, you can be exempt if that's a choice or a path that you want to go down. There is some exemption flexibility. Remember that the FFCRA has these two components of it. One is the sick leave piece and the other is the family leave piece. You could potentially go down the path of claiming an exemption from the family leave portion, but go ahead and honor the sick leave portion just because the sick leave portion is less hours and potentially from an administrative and an employment standpoint a little less burdensome. So there is some flexibility. You can choose to be exempt from the whole thing, from none of it at all, or from some of it. If, again, the 80 hours seems a little reasonable and okay, honor that. But if the family leave portion doesn't, then consider exempting yourself. States have already weighed in on this, and there are states who have put in place, in a sense, their own sick leave and family leave provisions, and those will supersede this. So even if you get an okay for an FFCRA from the federal government, you may be in a state that has some provisions now in place, Colorado being an example, that supersedes the FFCRA exemption you might otherwise get. It's important if you go down the exemption path that you then make sure that you modify any policies in your policy manual to be compatible with or in accordance with whatever your exemption action is going to be. You got to inform your employees in writing that this is the case, and you can certainly visit our website. We've got a resource page or contact information that will give you a lot of this information. Now back to the FFCRA update. It's important for you to understand that even if you did go down the path of exemption and exercise the exemption, it still doesn't have your problems or challenges go away, because you're going to have people who get sick. You are going to have potential quarantine orders and child care and school issues. So time off is still going to be needed. The exemption doesn't eliminate that problem. And then the question becomes, well, what's going to happen? And are you going to, if you're the employer, take a position that says, well, so sad, too bad, you're just out of luck and I'm exempt and you don't get any money? And how will that potentially impact both your reputation as an employer as well as your ability to recruit people when and if you're needing to hire people? So at play are some of these other items that are listed on the screen about Can people take their normal PTO or vacations or sick leave and use that time in lieu of any wage replacement? What about unemployment? And what about, again, this idea of will this actually contribute to more turnover and more employment issues if you choose to go down the path? Remembering, again, the government funds this. The government is paying for it. Financially, you're not out any money. It's just more, like I've said, an administrative hassle. The employment challenges, again, regardless of exemption or not, are there and will continue to be there. And they can take the form of an employee saying, I've been exposed, or I think I've been exposed, or I've tested positive. And then the issue becomes, well, what do you do? First and foremost, your number one resource has to be your state health department. There is no set answer. We call state health departments. We have clients all over the United States following our advice, are checking in with their state health departments, and they're getting answers that are all over the place. Some say shut down the office. Some say just quarantine the person. Some say just have the person not come into work for the recommended 10 days. So it varies from state to state, and a lot of this is driven by the metrics that each state is dealing with in terms of total number of cases, incidence or rate of new cases, etc. So this is an absolute moving target. It varies from state to state, so your number one resource has to be contacting your state health department whenever issues of exposure or testing positive come up. CDC at this point, as you all know, is recommending 10 days of quarantine. They're also saying if a person doesn't have any symptoms for 72 hours, they should be okay. Also, please understand the CDC is not recommending multiple tests, partially because of how long it takes to get test results back and because of the incidence of false positives. That this idea of just doing a test or someone doing a test every week for some period of time and thinking when they get a negative they're going to be okay, even the CDC is saying that's just crazy. Differentiating factors relate to whether someone is symptomatic or asymptomatic, and again, testing can come into play about positive or negative. If you have an employee who tests positive, by all means, you should send this employee home to quarantine. Again, you follow your health department, the healthcare provider, and/or CDC recommendations. If this employee was working during some period of time while they were potentially contagious and/or exposed, clearly you want to go through and follow the OSHA protocols for cleaning all the areas where this person worked or potentially came in contact. You've got to notify coworkers, and you should be doing this without divulging the employee's identity, and that's basically HIPAA medical information. And we appreciate that if you're in an office with only 5 or 7 or 10 employees, that can certainly be challenging, but trying to not disclose is an important thing. Determine when the employee can come back. Again, this will reiterate some of what CDC is saying, number of days, number of hours being symptomatic or asymptomatic. And again, even the CDC is saying do not rely on a negative test as your means of having this person come back. You can note the last little bullet there. They're saying that people could still test positive for up to 3 months after infection, obviously long after that person would otherwise be contagious or a risk for other people to be around. And if you do have an employee where there is an infection, by all means, follow OSHA protocols and your state protocols for reporting these. So back to employment challenges. Some clients are wrestling with off-hours activities in terms of what someone is doing, and certainly that relates to travel. This is certainly a challenge. It's a challenge because on one hand, you would like to control what people are doing in their off hours to minimize risks to you, all of the other employees, and your patients. And yet the reality is you don't have control over what people really do in their off hours. You can certainly encourage, you can request, you can beg and plead, you can ask, please, please practice social distancing, wear a mask, don't go to hot spots, etc. And if you put in some sort of measure that says if you go somewhere, and then when you come back, you will be quarantined. Well, now, especially if you've claimed exemption and this person is going to lose any potential compensation, you now introduce this element about an employee potentially not being honest with you about where they're going and what they're doing. And so you've got to find a way to navigate through this that works for you and works for the team. We're approaching the fall, as I said at the outset, and thus comes up the issue of schools and childcare. And whether the issue is in-school learning, in-person learning, whether it's at home or whether it's a hybrid. And obviously all throughout the United States, this is varying depending upon states and counties. I put this little piece on here, don't get mad at the teachers or the schools, because a lot of times as school districts are making the determination about in-home or in-class or a hybrid, people have a tendency to want to get really mad at the schools, the school district, or even the teachers, and understand that these decisions are coming down more from the states, and the states have metrics. Again, these metrics are how many cases do we have, how many new cases have there been, etc. So if you really want your kids to be back in school, and if you really want your kids to have childcare, then on some level, you and everyone else needs to stop doing dumb things that are otherwise contributing to the continuation of positive cases. So you be mindful of your travel, you be mindful of your activities and what you're doing, and you work to encourage other people to also be mindful of those things. It will become pretty self-serving because in the process the metrics will go down, schools will begin to reopen, and childcare will then begin to be more readily available. Again, I talked earlier about the FFCRA update and exemption. You've got to decide whether you're going to be exempt for some, all, or part of it, and what the ramifications of that are. When someone is off work, again, there's potential wage reimbursement through FFCRA. You can simply decide to pay the person or not pay the person. There is also pandemic unemployment assistance, which is a little extra wrinkle that is available through unemployment. Potentially, if people do have accrued and unused vacation, PTO, and or sick leave benefits, those could be used. So you've got to start to be a little more creative here. You've got to expand your almost like peripheral vision and view on looking at ways that can support and help both you and your employees get through this. Clearly be fair, be consistent, so you don't set yourself up for resentment issues or, worst of all, some kind of claim about discrimination. Work with your employees. Discuss potential solutions and options and strategize together. And relative to that, and looking at strategizing, there can be the use of intermittent leave. Remember, someone has sick leave up to 80 hours. They have family leave up to the 12 weeks. 10 of them are paid. This leave can be taken intermittently. So if a person is having to deal with in-home schooling for their kids in the morning, but they can work in the afternoon, then FFCRA wage replacement could be utilized for the morning, and then the employee comes in and works in the afternoon if they can also have childcare, or they're doing some sort of thing with a spouse or another employee. Employees are getting together and going, okay, I'll take our kids, this half a day, you take the kids in this other half day, and now you get, in a sense, a full-time employee. So that's this idea of work share and job share. Dental practices have for years worked in such a way that it's pretty typically 8 to 5, Monday through Thursday in a lot of cases. Maybe you have to think about changing your hours. Maybe you have hours that go later in the day when an employee who wouldn't otherwise have childcare or have school challenges would have someone else available to do that. Also think of your patients, because just because, or in addition to your employees having challenges with this, your patients are going to have challenges too. And some patients may not be able to come in to the practice between your typical hours because they otherwise don't have childcare or are otherwise dealing with school issues. So there are a lot of creative ways when you start thinking out of the box to work on this. In working on it, to build this organizational success, you've got to spend more time focusing on your people and outcomes and not just results. I said earlier in the webinar that initially when the pandemic first came down, it became an issue of crisis management, and now it's really more an issue of leadership. And how do you lead this organization to success? And people are an absolute critical component of that and are the primary source of a competitive advantage. It's through your people that patients actually decide whether you're really a good dentist or not, or the practice for them. Obviously, there's a big challenge out there in finding and retaining, and a lot of that's because hygiene schools closed and dental assisting schools closed, and people have not been able to take their boards, and so we don't have as many licensed professionals out there. In addition, some people chose in this to retire. Some people chose to change careers because of concern about the risk. So there's a whole lot of contributing factors to this. And as the leader, it becomes critical from at least our vantage point that you look at your people truly as a resource as opposed to an expense. All too often, sadly, I think, people look at the employees simply as an expense, like a necessary evil. Well, the reality is they are your competitive advantage. They are a resource, and the reality is you can't do this without them. What's also true, like it or not, is wages are going up and will be going up. I appreciate in dental practices that a serious metric that is tracked is overhead, particularly for payroll and for staff. And we all know it's the highest percentage of overhead for any dental practice. It's kind of the nature of the beast. The reality is that's going to go up. We don't see it going up a whole lot, but it is going up. When you think about it, if your practice does, and let's just pick a number out of the air, does $1 million a year, and your staff overhead now, as a result of this, is 1% higher, that 1% is $10,000, and that's $10,000 spread across various employees. If you have employees who are working 3/4 time or the 4-day week of a typical practice, that's about $1,600 hours in a year. $1 raise is only $1,600. So we're not talking really about a huge amount of money, especially when you do sit down and do the calculations, again, from a leadership perspective, as opposed to just going ballistic over, oh my gosh, I'm going to pay people now 50 cents or $1 more an hour. That's just cutting off your nose to spite your face. Relative to leadership, here are some questions that are really important to think about. And the context that I want to put this in is this. You spend a huge amount of time, energy, and money on your brand and on your reputation as a dental practice. And you work really hard to make sure you've got great Google reviews, you've got great Facebook reviews, and all of that kind of stuff. What you also need to be focusing on is what is your reputation, what is your brand as an employer? What would be your Google reviews if you were being reviewed as an employer? And would you work for you? And right now, with everything that's going on, it is critical that you give some thought to this and how you can increase your brand and your reputation as an employer. And the reason for that is not just academic. We have clients all over the United States. We have some clients who absolutely take a view that says, my employees come first. I, as an employer, work for my employees. How can I support them? How can I help them? The interesting thing is, those employers are not having any problem finding people to come to work for them. Those employers have not had any trouble in people coming back to work for them and reemploying them. It's the ones who truly look at employees as an expense, and again, kind of a necessary evil, are the ones who are having the biggest challenge because they do not have the kind of reputation that supports ease with respect to retaining people and hiring people. Speaking of hiring, the biggest mistake that dentists make is you hire people based on skills and experience, and you should be hiring people based on their attitude and their fit within the type and kind of organizational or practice culture that you have and you want to create and maintain. The second biggest mistake is you hire someone because they kind of have a pulse and because they have some dental experience, but then you do not go through a more structured, formal process for ongoing and engaging them from day one. So onboarding, statistically, it's proven over and over, it increases retention by 25% and performance by over 11%. So when you engage in this, people stay, and they stay longer. It takes 6 to 12 months for someone to be fully up to speed and fully engaged. This is not something where you get to just throw them in and say, read the manual, sign these forms, and now tomorrow you're in the hot seat, go. It does not work like that. So in developing a more structured and robust onboarding, here are some questions to answer and build as a framework for a structured and more successful onboarding program, even down to goals for the first day, for the first week, etc., and goals all the way out to the first year. This will really support a culture of retention. And a culture of retention is where people have a sense of belonging and inclusion. They're encouraged to speak up. They have a sense of purpose with their role and their contribution to the practice. And with that, it has meaning with the job they do and the role or roles that they have. And of course, what this does, it builds a sense of contribution. People then feel valued and being part of this through recognition and through appreciation. These are all leadership principles. These are what will lead to a culture, again, of retention. and people staying around. It's about communication, and it's important. When you don't communicate, we all do this. When there's no communication, we assume the negative. When there's no communication at all about what I did, how I did, then I could go to a place of, well, what's the point? Why do I care? And engagement will go down. Engagement is about the extent to which someone enjoys and believes what they're doing. Engagement is about the degree with which a person feels valued, the extent to which a person feels committed, and the extent to which, as a result of that commitment, people will stick around. Engagement is huge. The interesting part is sometimes the focus in HR, again, gets all mucked up with money. It is statistically, and from all the studies, it's through these kinds of things that creates retention, and it's through the lack of these things that contribute to turnover. It's not how much money someone makes. That is an element or a factor in, but it is always much lower on the list. And these kinds of things that we're talking about that really support engagement don't cost anything. So today, you can't build a practice that's very successful without engagement, and that's about leadership. It reduces loneliness in the workplace. It reduces ghosting. It reduces turnover. And in so doing, it increases a sense of belonging, a sense of performance, and long-term retention. So it's an engaged workforce that really is the winning team and therefore the competitive edge. So in summary, your action plan: get your HR and your employment compliance house in order. Go through the process of deciding what you're going to do with FFCRA in terms of compliance or exemption. Get clear about it. Make sure you update your policies. You make sure you get this communicated to your team. If you have a policy manual, by all means, make sure it's up to date. If you have one, you might consider getting it reviewed, especially if it hasn't been looked at and it's just been sitting on the shelf for the last 2 years or 3 years just collecting dust. If you don't have a policy manual, by all means, get one. We clearly are a resource. We're Benco's HR resource for Benco clients. If you get a policy manual, it should be state-based because there are uniquenesses in every state. It needs to be dental specific based on the number of employees that you have, customized and personalized for your practice. Make sure you get your job descriptions up to date and current with the Americans with Disabilities Act compliance provisions. Make sure you up-to-date SOPs because a whole lot of your standard operating procedures have now changed in the face of COVID and new procedures and protocols. Tighten up your record keeping so you reduce any potential risk and liability of things happening negatively from an HR standpoint. And really, if I could do nothing more, it's to encourage you to create an organizational culture of employee engagement, which again will feed long-term retention. So we're going to kick this open to questions, and before I do that, I want to just draw your attention. You can log on to our website. You will note right on our homepage there's a resource library. It's got all kinds of Q&As in there. It's got all kinds of FAQs as well as reinstatement guides, and all of this is available to you to access, to learn, and to help ensure that you're crossing the T's and dotting the I's. Here's our 800 number. You can also email us at info@benterickson.com. And so I'm going to open this up to Q&A. And I assume that, Kay, you're back on the line, and we also have Michelle on the line. And so let's dive into any questions that may exist.
So Michelle, why don't you go ahead and read off the questions of the ones that you want him to answer. Guys, and let me just say this. Please make sure that you give us some more questions, give us some more feedback, use the Q&A. We really want to know what you think, and now's an opportunity to really pick Tim's brain. So go ahead,
Okay.
Michelle, you on?
I am, and so the first question that came in was not based on the FFCRA questions at all, which is fine. Came from, do you want me to say the names of who these came from, or just
No,
answer the
I wouldn't say
questions?
the names. Why don't we just answer? I think
Okay.
confidentiality is
Okay.
important, so why don't we just answer the
Okay,
questions?
sure. Sometimes I'm on and people will say whose question it was. So this question is based on, in their state, they have easy mail-in voting option, and they were curious if they were obligated to offer time off for in-person voting. I'm not sure where this individual is located. Some states do have requirements that if your working hours do not allow your employee outside those work hours to have ample time to go to the voting areas, that yes, you would have to, most states that have these laws require that the employee notify you that they want this time, and you would have to allow the time, and then they would be able to go and vote. Now, if they're in your state, there's an option of voting in person or voting on through the mail, then I would say that if you, the employer, can't dictate which way your employee wants to vote. So if your employee is choosing not to want to do it by mail and is choosing to still do it in person, and they need enough time outside of your normal working hours to do that, then yes, you'd want to make sure that you're abiding by the laws in your state and allowing the in-person to go and vote. Hope that answered it. So next question was, it's moving on me. I think it means, does an employee qualify for family leave if their child's school is virtual and child cannot be left at home during this virtual learning? So yes, if the school closure is actually about physical school closure. It's not about whether the children are learning or not, and virtual learning is not that the school is actually open. School is still closed. They're just choosing this route through e-learning and virtual learning to help the children continue on with their education until they are able to open the doors physically. So with that, yes, your employee would likely qualify, unless you're going the exemption route, would likely qualify to receive the FFCRA expanded family leave to deal with their child's need for supervision for virtual learning while they're home. And so there's also the aspect of hybrid. So a number of areas across the country are already able to start the school year in a hybrid situation, which typically is looking like the kids will be at school maybe 2 or 3 days a week, and then virtually learning from home the other 2 to 3 days a week, depending on their schedules. And so the days that the parent, your employee, has to be home on those virtual days would once again qualify them for the ability to use FFCRA and that intermittent leave so that they can be home with their kids on those days, and then they would work for you, obviously, on the days that their kids are in school. Now, the one thing that I think is a positive point for employers as you navigate this is that, so for instance, the school district my children are in, they have the option, or we as parents and the kids have the option, that even though when we go into a hybrid situation or we go into a full in-person instruction situation this year, 2020-2021, the students can choose to do online learning for the entire year. If your employee chooses to do this, even though their child could be at school, the doors are open, they physically could be there, once that occurs, FFCRA goes away because the school is actually open. So this can be good news. You know, it's for you. If your employees are choosing just to keep their kids home, you would not have to provide FFCRA anymore, which means the job protection portion of it goes away as well. And you could choose to say, I appreciate that you've made this decision for your family. I understand. I can't hold your position open anymore, and I'm going to need to look for someone to fill it. So that is, I think, kind of on the positive side, the Department of Labor has definitely weighed in that the employees don't have a choice. If the school is open, their kids should be going back to school. On the other,
Michelle. I was going to jump in on another question.
Sure.
So there was a question about this idea of deferring the payroll taxes, which is an executive order that President Trump put in place. And just know that there was initially this whole thing where everyone got a stimulus check, or most people got a stimulus check of $1,200, and then there was unemployment, and then there was the unemployment kicker of $600, and those things have all gone away, and Congress continues to fight over whatever some next stimulus bill is going to be, and as a result, President Trump signed an executive order that said employers could stop taking out of an employee's check the Social Security piece that is otherwise deducted from an employee's check. And the thinking is, well, that would mean your net take-home pay would be a little bit higher. And so this was sort of an end-around way to attempt to put a little more money in employees' pockets. The downside is it's not free money. It still is going to have to be paid back, which means there's a point where you then have to start taking that out again, and you have to take more out to recoup whatever was taken out. It is up to the employer to be able to decide whether to do this or not. It's not up to employees to say, hey, this is available and you need to start doing it. It's at the employer's discretion. And the reality is most employers are choosing not to do this because it just sets up this false sense of security of being more money, and then now all of a sudden it's going to have to be, in a sense, repaid. So that's the piece about deferring taxes and the question that came up associated with that.
Very good. The second portion of the question that came in was whether, back to the child care and virtual learning, was whether a dentist could qualify themselves to receive FFCRA if they were home with their children. This individual states that they are not actually on payroll, that they're not being paid as an employee. I would believe that since you're not being paid as an employee, that you're likely not going to qualify to then have your practice pay you FFCRA payments while you're home with your children. For all of you who are employees of your practices, then yes, you would qualify. You are an employee, and if this is what's happening with you, we have clients, two married individuals who are switching back and forth and taking care of their children and running their dentist office, and yes, on the opposite side of this, they could pay each other through the FFCRA and then apply for the tax credit. Let's see here. I think some of these were just kudos, so thank you. Tim appreciates it.
Yeah, let me there's a couple other things on voting, and I will just reiterate or add to what Michelle said. So relative to voting, it's determined by each state. Obviously, some states have mail-in, some states don't have mail-in. We're in Oregon. Oregon does mail-in, has done mail-in. It was one of the first states like 20 or 30 years ago, something like that. So there's no issue about needing to give people time off to vote. So for the states that truly have an established set mail-in voting system, then typically there is no time off for voting. If there is not, or there is the choice, as Michelle said, to vote in person, then states will weigh in on this, and typically it's like if someone's work schedule prevents them from voting, but that one's kind of tricky because we know that most polls or voting stations are open from whatever time in the morning until later at night, and people typically aren't working all those hours. So most of them will say, well, this only comes into play if the person's schedule prevents them from being able to vote, and if so, then they'll say, well, a person can have up to, and Michelle, isn't typically, we hear a lot that it's 2 hours, or a lot of states establish about 2 hours. And then, yes, then the pay comes in, pay doesn't come into play. So it is absolutely determined by each state. And for those of you asking those questions, you can certainly email us at tell us what state you're in, and we'd be more than happy to provide you with the details for your situation.
So listen, I know we have to end this. So, as we're ending, guys, keep your questions coming, because what we will do is we will send them over and Tim and his team will answer them for you. And again, everyone will get a copy. So you have a few minutes left to keep typing. I'm just going to, first of all, Tim, I want to say thank you. I am so glad you are one of our success partners. Michelle, and you have done a great job informing us of a lot of great information. And I know that it's constantly changing. I think we just need to have you on every quarter just so you can keep up with everything. So, and I do think that more doctors need to hear this too. I think it's really important. So thank you so much for that. I want to tell you a little bit about some upcoming webinars, but the first thing I want to tell you is that if you will take your phone and actually scan this QR code, it will take you to our website and it will tell you about our Wednesday webinars. So it's a really simple thing to do, and if there's something that you want to see, it'll be on there. And if there's something that you want to see and that we're not offering, let us know. And then I also want to say really quickly, the upcoming webinar that's going to be coming up next week. There we go. It's going to be on September the 23rd. It's going to be with Dr. Alan Stern, and he's done a really good job. I saw his PowerPoint on how do I communicate with my patients through the mask. Because when patients come in, this is all they see now. And, how do I bring them from this to get me to accept me, let me feel warm, and move on with my treatment? He's really worked hard on this. He's going to be sharing a lot of great tips. Please make sure, if you can, to sign up. Again, even if you can't make the webinar, sign up and you'll still get a copy of the recording. So that's going to be, again, September the 23rd from 7 to 8 Eastern time. And then we're also offering one workshop, and right now telephone skills is the key. We are shorthanded. Some people are having to bring in new team members that really maybe not as trained as we want them to be. Catherine Nuttall is a master at communication. She's going to be offering a 1-day, 2-hour telephone skills class workshop for us. It's going to be on September the 18th. From 12 to 2. Again, it's $49 a person. You can't beat it. You will get 2 hours of CEs for it also. So please, even if you only get one person in your office to take it and then maybe share it with the rest of the team, it's going to be a fantastic workshop. So please make sure, if you're interested, to let us know. You can actually purchase it at shop.benco.com. And then if you have any problems, just let us know. So again, I want to say thank you. And I really want to say, any questions or comments or feedback, please let us know. The email address that we're asking you to send that to is practicecoaching@benco.com. Again, that's practicecoaching@benco.com. Tim, I hope that the fires go away. I can only wish I could blow them away for you. I hope I hope your home is safe and your family is safe and everybody at your office is safe. So I want to thank you so much for coming on again. You are so brilliant, and we really appreciate it.
My pleasure. Glad we could help. Bye.
Thank you, everybody. Bye-bye.